I will let you know today uh, about pup vaccinations. As you know, if when you bring your pup, that sweet smelling pup of yours, to your home, you need to take all the care of the pup. You need to give the best puppy food. You need to have plenty of attention. You need to give gentle training. You need to have safe toys. You need to have puppy socialization. And you need to have a comfortable home and a proper veterinary care for the pup, including the puppy vaccination in the pups, especially in the first year. Now, I will let you know, first of all, let me discuss the different types of diseases the pups or the dogs may suffer. Okay, and I will tell you the basic symptoms. On that symptoms and basis on the symptoms, I will discuss with you the vaccinations also. So I'll let you know the diseases, the basic diseases in the dogs. The first one is Bordetella bronchoseptica. Now, this is a highly infectious bacterium disease. Bacteria means it is caused by bacteria. It causes severe fits of coughing, whooping cough comes, severe coughs. There may be seizures. There can be vomiting and even death. Now, this type may lead to kennel cough. It is the primary cause of kennel cough. And for this is the first type of disease. The second type of disease a dog can suffer. I'm discussing the common types of diseases a dog can suffer. Canine distemper. This is very common, and it is a contagious and a severe disease and caused by virus that attacks. Canine distemper is the second disease. This is a severe and a contagious disease caused by virus that attacks the respiratory, gastrointestinal, and nervous systems of the dogs, and it spreads by coughing or by sneezing. It is a viral disease and it is airborne. It transmits to the air. Not only that, it can be transmitted by shared food. It can be transmitted by water bowls and the equipment. Suppose a pup is using a water bowl. He drinks water from one bowl, and the same water bowl we give water to another dog. So if this dog is having canine distemper, this disease can be transmitted to the next dog by simple like water. It can be through using the same bowl and all. Now, it is a viral disease here, and the basic symptoms of this disease is it causes discharge from the eyes, discharge from the nose, it causes fever, it causes coughing, it causes vomiting, it causes diarrhea, seizures, twitching of the eyes, like eyes twitching will happen. Sometimes paralysis can happen because it affects the nervous system, the central nervous system, and sometimes it can often lead to death. Now, this disease, that is the canine distemper, it is also called as hard pad because it causes the thickening of the foot pad. It causes the thickening of the foot pad. Now, there is no cure for distemper, but we can give a supportive treatment. Supportive treatment means symptoms to control vomiting. We can give to control vomiting. We can give or sneezing or cold. We can to control the seizures. We can give the medications to control the vomiting. We can give medications like if there is some like diarrhea, vomiting. There's vomiting, they can give Perinom. Doctors will give the Perinom injection, or some injection to avoid the vomiting. If there is diarrhea, they'll give anti-diarrheal medications along with B complex. Or then if there is the B1, like to avoid paralysis, if there is paralysis, the doctors may recommend to you all the neurobion injections, which can say B1, B2, B6. So all these things, all these injections, all this treatment, the doctor can detect. So this is the second second type of disease I've discussed with you. This is something about canine distemper. As I said, there is no cure for canine distemper. This treatment of canine distemper is only to supportive treatment. Supportive treatment means there is no, you have to cure these symptoms by giving some medications, like for vomiting, specific for vomiting. Seizures means like if there is something for the nervous system, some medication. If there is diarrhea and vomiting, then to control peristalsis, there will be some injections, and so and so forth. Now the third disease which I am going to discuss with you all is canine hepatitis. Now infectious canine hepatitis. This is also a highly contagious disease. It's a viral disease. It's a viral infection. It affects the hepatitis means liver, can affect the liver, it can affect the kidney, it can affect the spleen, lungs and eyes of the dog. This specific disease of the liver is caused by virus. Okay, so it can cause, now there are basic symptoms of this. I will let you know the symptoms. The symptoms of canine hepatitis, there can be slight fever first of all, then there will be congestion of the mucous membrane. Okay, then there can be vomiting, there can be jaundice, there can be stomach enlargement, pain around the liver. So all this symptoms come if the dog is suffering from canine hepatitis. But many dogs, what happens, there is no cure for the dogs. Like again here, symptomatic treatment has to be given. Symptomatic means supportive treatment has to be given. There is no pure cure for this disease. Like you can give, like for example, for vomiting, for jaundice. Okay, for jaundice there will be some L52 syrups, or some for vomiting there can be Perinom, and so many. There can be for pain around the liver, there can be painkiller, and painkillers can be there. Then the liver tonics can be there. So these are supportive treatments which a vet you can discuss with you. Vet will discuss with you and he will prescribe you. Then next one is canine para-influenza. This canine para-influenza is also contributes to the canal cough. Okay, so it is same symptoms as if I discussed with you earlier as Bordetella bronchoseptica. Okay, the next disease we can go to, as we say, we are here, coronavirus. Coronavirus also takes place in dogs. It is not, this canine coronavirus is not the same as our COVID-19. Okay. Canine coronavirus affects the dog's gastrointestinal systems. Okay, and also the respiratory systems. It may show vomiting, symptoms like vomiting, diarrhea, loss of appetite. So also it can show sometimes nausea. So your dog should be kept hydrated, warm, comfortable. Okay, here also supportive treatment should be given because there is no treatment for coronavirus in dogs. The next one is a heartworm. Now when you see your puppy is around maybe 3 months, that is 12 to 16 weeks, you have to take your pup to a vet for heartworm prevention. There is no vaccine available for this type of disease, but it can be prevented with regular medication. Thus, your veterinarian will prescribe to you. Once you go to him, you tell him that you want to check him for heartworm and also prevention. What are the measures to control heartworm? These worms, heartworms, is very dangerous. It may lodge in the right side of the heart and the pulmonary arteries. Okay, and it can affect the liver, it can go up to the kidneys, and these worms are very, they can become up to 14 inches long, and they can even harm, they clump together and they can block some organs and injure the organs. If they go directly into the heart, it can block the valves and so on. This heartworm infection they show no symptoms, but you can see that the dog may have severe cough, your pup may become lethargic, may have loss of appetite, have difficulty in breathing, he may become tired after a small exercise. They pass urine, which are these diagnosis should be made via blood test and not by a fecal examination. So usually for heartworms, a blood test is done. So a veterinarian will tell you. So you know some symptoms and how to recognize them. So next one we go is kennel cough. Kennel cough is also known as infectious tracheobronchitis. It results in the inflammation of the upper respiratory tract, and it is caused by bacterial, viral or other infections such as Bordetella. As I mentioned earlier, it can be caused by canine parainfluenza, which also involves multiple infections. Okay, here in this case, kennel cough, it can be, usually the disease is mild, but sometimes it causes bouts of dry cough, harsh dry cough, and it can be very, very tiring, very deadly, and antibiotics are usually not necessary for this type of cough. It will not cure, but cough suppressants, it will be more comfortable for your pup, and also the supportive treatment. The next one is leptospirosis. Leptospirosis is also caused by bacteria, but some dogs may not show any symptoms at all, and it is found, this leptospirosis is found worldwide in the soil and water. This leptospirosis is a zoonotic disease. Now what is zoonotic? Zoonotic means it can be transmitted from the human beings from the animals to the human beings. It can be spread. When symptoms appear, they can be again fever in the dog or a pup, fever, vomiting, abdominal pain, loss of appetite, diarrhea, weakness, lethargy. It can be stiffness also. There can be jaundice. There can be muscle pain and kidney failure, liver failure. Now in leptospirosis, yes, antibiotics should be given and they are very effective. Okay, and you can, these are, once you tell your vet, the vet will prescribe you the necessary medications or antibiotics. The next one is Lyme disease. Lyme disease is an infectious disease, is a tick-borne disease. Sometimes you must have seen that lot of dogs will have ticks, small ticks. Okay, so for this type of dogs, it's better to check for Lyme disease. Okay, so it is caused by the type of bacteria called as spirochete, and it is transmitted by the ticks. In this case, what happens is that the lymph nodes in the body of the dogs get swollen. The lymph nodes get swollen, the animal starts limping, the temperature rises, that is, the pup gets fever, and the animal may even stop eating. Now, all this disease can even affect the kidney, can affect the heart and the joints, may cause neurological orders, means the animal may get confused or it may get paralyzed if untreated. Okay, so in this Lyme disease also, the veterinarian will prescribe to you some antibiotics or whatever necessary. Now, the next one is parvovirus disease infection. This parvovirus infection is highly contagious. It is a viral disease and it affects almost all the dogs. But now the virus attacks mostly the gastrointestinal tract. Sometimes we say, oh, the dog is having worm. In this case, the symptoms shown are loss of appetite, there can be vomiting, there can be fever, there can be diarrhea, or there can be blood in the diarrhea. So there can be, in this case, the dog will vomit and have diarrhea, a bloody diarrhea or blood diarrhea, maybe 4-5 times a day or maybe 7 times a day. So as a result of which, there can be extreme dehydration and the dog can be, it can even die within 48 to 72 hours. So if there is this type of symptoms, immediately take to your vet. The thing is that you cannot, extreme rehydration is necessary immediately. Treatment is necessary immediately. Otherwise, your dog may die or collapse. So rehydration, basic thing you can do is bring some glucose, home remedies, glucose, put in the water and give it to your pet, and then take your pet to your veterinarian immediately for treatment. This is a very deadly disease and this specifically occurs mostly in India. The rabies, the next one I'm discussing with you is rabies. Now this rabies is a viral disease. It occurs in dogs. Okay, it occurs in a lot of mammals. It occurs in cats. It occurs in dogs. It occurs in monkeys. Okay, the rabies is a disease, is a viral disease. It attacks the central nervous system. Okay, so what are the symptoms of this? When the dog has rabies, it causes severe headache to the dog. So it causes headache, it causes anxiety, it causes drooling of the saliva, that is extreme salivation. Some of the dogs will be lying like that with lot of salivation. So in this, you have to take care not to go near to this dog, because these are maybe the symptoms of, or you have to check with your veterinarian, maybe the symptoms of rabies. There can be anxiety, there can be hallucinations, fear of water. Suppose if you keep a bowl of water, or there is drooling, or he is not able to drink the water, he may have the fear for the water. Hydrophobia. There can be paralysis. Since the central nervous system is affected, there can be the nerves become stiff. The virus attacks the nerves become stiff. As a result, the animal is not able to swallow or drink water. He gets scared to drink water. Okay, paralysis, and there can be death. Now, this is also a zoonotic disease. It can be transmitted from the pups or from your animals to the human beings. So you have to take care, my dear friends. Check for rabies every now and then. Vaccinate your animal, vaccinate your pet for with this vaccine, rabies. It's a very dangerous zoonotic disease. Now, this type of disease is mostly transmitted to the bite of rabid animal. If an animal, suppose if your pup is playing with another pup, his saliva touches him, or if he is biting him, okay, it can be transmitted in that way, and within hours of this type of infection, the treatment should be given. Otherwise, death is likely. Okay, so to avoid all this, to prevent all this type of things, to prevent this symptom, to prevent this type of infection or disease, one should ensure that the dogs or pups are vaccinated, which is very mandatory, with rabies vaccine. Okay, so now I have discussed with you a couple of diseases which are very common in dog. The first one was Bordetella bronchoseptica. The next one was canine distemper. Third one was canine hepatitis. Fourth is canine parainfluenza. Fifth one is canine coronavirus. Sixth one is heartworm. Seventh one is kennel cough. Then eighth one is leptospirosis. Ninth is Lyme disease. 10th is parvovirus, and 11th one is rabies. So these are the most common diseases occurring in dogs. Okay, so now I will discuss with you the vaccination schedule. So I will let you know which vaccine prevents which diseases. Okay, now the vaccination schedule. So usually I will pups age. When the pups, why do we give vaccination first of all? The vaccinations are given so as to prevent certain diseases. I'm not saying the pup may not get, but it prevents, at least it prevents the diseases occurring in the dogs or your pets. Now, always the puppy vaccinations should be discussed with your pets, and all this vaccination should be done regularly with scheduled appointments. Now, when the pup is 6 to 8 weeks, the recommended vaccination is distemper and parvovirus. These are the vaccinations to prevent Bordetella disease, okay, or Bordetella infection. The second vaccine is 10 to 12 weeks. This 10 to 12 weeks of age of the pup should be given. Again, this is another vaccine. This is a vaccine of distemper. This contains so many things. DHPP is vaccine for distemper, hepatitis, parainfluenza, and parvovirus. So the vaccinations, the diseases it will prevent is influenza, leptospirosis, Bordetella. Okay, so the next one next vaccination is 18 weeks of the age of the pup. Then again, it's a booster dose here, that is distemper, hepatitis, parainfluenza, and parvovirus. Also, it is called a DHPP short form. And along with that, rabies also vaccination should be given. 16 to 18 weeks. Now, the infections which it will prevent is again influenza, leptospirosis, Bordetella, and rabies. Then 12 to 16 months of age, you give again DHPP and rabies vaccine. Okay, so again it will prevent leptospirosis, bordetella, hepatitis, distemper and rabies. Then again, this is 12 to 16 months. Now every 1 to 2 years, you can again follow DHPP, and again every 1 to 3 years, rabies can be done. But rabies should be followed every year. That is what is my recommendation, rather than to wait for 3 years. So every year you can give DHPP and every year you can give rabies. Okay, so I think, my dear friends, I'm clear for all the information